So welcome to the Health and Wellbeing Board. I'm Meryl Watkins, GP on the CCG governing body. Councillor Pooter's not able to chair the meeting today, so just apologies from him. As you're probably aware, the meeting is going to be broadcast live, and it's already started, and they'll let us know when the broadcast is finished. The video will also be recording and will be on YouTube as a record. And any informal chats within the comments isn't going to be formally captured, so just bear that in mind. If it's something quite important, I recommend you just speak it out loud. Just a bit of housekeeping: if you can keep your microphone on mute when not participating, and if you do want to say anything, which obviously is encouraged, then ideally, if you can use in the conversation box, just put an asterisk or some kind of symbol, or put your hand up. That's the other one. Just you can just raise your hand. That'd be really helpful. We've had some apologies from Councillor Pooter, as I mentioned, Councillor Williams and Jane Needham, who's replaced Tim Broadley from the DCHS Foundation Trust.
I've received another apology from Tracy Allen just this afternoon.
Okay.
Thank you.
And any other apologies apart from them? No? Okay.
Kim's just dialing in as we speak.
Right, okay. There's no late items that I've been made aware of. I presume nobody else has got any late items that we should be aware of? No? And no declarations of interest apart from what's been declared already. Is there anything anybody wants to mention? No? So the minutes from the 12th of November, I'll take them as read. I wasn't actually there, so shout up if there's anything that you want to highlight or any concerns, corrections.
Hi, Meryl, it's Alison. Just to note, there is one outstanding action, which is at the very end of the minutes, and that's an oversight. There was a request for the Mental Health Delivery Board to bring a report on the back of Health Watch's report at the last meeting, so I'll take that away and bring that to a future meeting, Meryl.
Okay. I mean, I also read the meetings. Certainly in general practice, we've seen a massive increase in mental health consultations, and slightly worrying, they seem to be from people who've never had mental health problems before. So it's not the people who've already got mental health that are having problems. It's people who have, I think combination of things: lockdown, working from home, losing their jobs, furloughed, school, homeschooling, everything you possibly think could go wrong in someone's life seems to be triggering mental health. So it is a massive area that general practice is dealing with it, and we only see the people who contact us. There'll be many more. So going on to the section, it's over to Robin Jewis to give us an update on the COVID outbreak, engagement board and health protection board. Are you able to do that, Robin? You're on mute.
Sorry. Our usual health protection board hasn't met since the last time, so we don't have an update from that board. And just from the COVID board perspective, I've just got an update of our latest data, and then I thought if we just open it up for questions and conversation along that, as you know, things are rapidly changing. So I'm hoping this is sharing, and I'll just has that come up as presentation?
Yes.
Yes, yeah, that's up.
Lovely. So what I'm going to do is just to run through our latest data report, and this data report is published every week on our website, and this is the data up to the 9th of January, which is our latest reporting data. And for that week, for the city, we had 1,706 cases. And importantly as well, during that week, 186 of those were pillar 1 tests. And these are the tests that are carried out in the hospital and are a level of indication around the impact on hospital admissions as well. And that gives us a rate of 663 per 100,000. And that is quite a significant increase for us over the last few weeks, but also within the context that we are ranked 114th nationally. So even though we've had a really significant increase and are at the moment continuing to increase, we still have 113 local authorities with higher rates than we do. And it just puts that context on it. And if I show you the chart here. So this shows the chart from the start of the pandemic, and we can see the blue bars are those pillar 1 hospital-based tests, and the orange bars are the pillar 2 community-based testing. And the pillar 2 testing was not available at the beginning and became gradually more available over time. So it's really more informative to compare from sort of early July really as to what's happened with those figures. And you can see that we were very low in the summer. We had the peak around the end of October, beginning of November, when we had the second national measures brought in. And you can see as we came out of that and into December and we were within the tiering system, you can see that the measures that we had in place were clearly not sufficient for us in the city to keep a control of the virus, and we were just gradually creeping up. And then over Christmas and New Year, there's quite a number of things will have influenced that. We know that there was a reduction in people going forward for testing. And we obviously know as well that there was the Christmas mixing as well. So we anticipate there will be an increase. But we can see the first week after Christmas, we see this really large, almost doubling of numbers. And then this is our latest numbers of cases. So the difference between these 2 weeks, there's a number of explanations, I think, for that difference. It may be that we've got a slowing down of the increase in rates. It may be that this particular week we see where we had the large increase was actually a large increase due to a delay in the catch-up of that testing. So people didn't go for testing before Christmas, but perhaps went afterwards. So it's difficult to say what the trend is at the moment, and we need to see the next week's data. But certainly good news that we didn't see a doubling again in this week's data. When we look at this across age groups, and we've got a specific comparison here between 17 to 21-year-olds and the over 60s. And we can see that from a younger person's perspective, there's been a continuation of that increase. For the over 60s, we can see in the latest week's data, there's perhaps a hint of a slight tail off within that age group. And this is the particularly important age group for us as it drives the hospital admissions data. We know a couple of weeks after we see the numbers in this age group, it translates into those changes in the hospital admissions. And this is a map of the city, and it's just showing middle super output area, which these areas aren't necessarily aligned directly with the wards, but they relate to a reasonably similar size of population. And these are rates which are the numbers of cases which have been found within that week related to the population in that area. And you can see that the greatest concentration of cases that we've got at the moment is around the Rosehill and Castleward area. But we can see some of the areas where we've previously had larger numbers, particularly around Littleover and Heatherton, around Normanton and around Sinfin, again, showing those higher rates of cases as well. So that's the data to share with you. Very happy to take any questions on the data, but also any questions around any other COVID related issues currently. I think you're on mute, Meryl.
Oh, sorry, I'm doing the same as you. I don't know whether you want to say something, Gavin, about what's happening in the hospital. She put something in the chat.
Hi, Meryl. Yes, I can do. So, I mean, it was really just responding to Robin's kind of presentation of sort of prevalence in the community. I mean, absolutely, those graphs mirror the experience in the hospital. So, first wave about 250, and then up into kind of early November, mid-November, we were at sort of 300-ish at the hospital. Then a bit of a lull back down to about 200 in December, and then over the Christmas period throughout January, we're now up to 516, which is, I mean, as I said, it's comfortably more than double what we had in the first wave. So it's a really big challenge. I mean, just to reassure people, and I think the hospitals are responding well, and I think the wider community too. So we are able to discharge patients that we need to, and to maintain flow. But increasingly now, our general and acute beds are being switched from green, i.e., people who we think are low risk of COVID-19, to red, where we have a positive diagnosis. I think the most critical factor, though, is critical care capacity, because we're accommodating a large number of patients, but there is some good news here. So in terms of our numbers of patients in critical care, it's similar to the level that we saw in wave one. So although we've got twice as many patients in our hospitals, it's about the same number in critical care. Now, there's probably two reasons for that. One is I think it may be that the treatments that we're able to offer patients mean that when they're admitted to hospital, they're less likely to require critical care treatment. So I think that's positive. So things like dexamethasone, and obviously Derby was one of the contributors to the research which identified dexamethasone as a treatment. So that's clearly helping us. But I think the other factor as well is we've also increase the amount of other treatments we can use outside of critical care, like high flow oxygen and something called CPAP, which is a way of giving patients an increased level of oxygen to help them whilst they're in respiratory distress. So it's a really challenging picture. I was kind of rather hoping when I was looking at your graphs, Robin, that we could maybe see something coming down a bit. Would be really appreciated about now. So I'm kind of rather hoping that the latest lockdown will start to feed through. But of course, there's a lag. So Robin's figures sort of lead what happens to the hospital, because obviously we catch up a couple of weeks later. As people become very poorly, and then inevitably are admitted to us. But it's a really difficult situation, really challenging. But it's being managed. I think the other thing I would say is we've got a bit of a ray of hope with the vaccine, but this is no time to take our foot off the brake. Really, we all of the the lockdown restrictions, the hands, face, space, all of that, more important than ever, really, whilst we ramp up the vaccination programme, which I have to say, I think as a system in Derbyshire, in the city and the county, I think we're doing incredibly well. But that's just a bit of an update, but I'm happy to answer any questions as well.
Thank you. Roy, did you want to come in?
Yes, please. Gavin's last point about we're doing incredibly well with the vaccine. It doesn't appear so, according to our local press, and I think we're missing out on the messaging there. I've been contacted by the national press about it and about the particular article in the Derby Telegraph. I've got to say that I'm supportive of what we're doing. The arena has had some fantastic comments from local people that have attended there, and how things are going there, how safe it feels, and the way they're getting through the patients there. But it's not helpful when local media put headlines that says the arena's been out of action for 2 days, and it has caused a lot of speculation, but on social media, I've got to say that the people that have been to the arena are really showing their support for that.
I mean, I've been working at the arena. I've done a couple of shifts. I'm doing one tomorrow, and the every available dose is being given out. So the limiting factor is not the staff. There are lots of staff who are coming in, days off. Practices are giving up staff as well to go there. Nobody's concerned about the pay or what level of duty they're doing. At the moment, it's just vaccine supply, which will resolve. I think that's just a very early stages issue, and it will resolve. Chris wanted to come in. Chris Clayton, do you want to say something about it?
Yeah, thanks, Chair, and thanks, Roy and Gavin. Just a couple of things, really, and looking to support from the Health and Wellbeing Board in the conversations that you have. So, you know, in these times, networks is just really important in getting the right messages out. So, let's be frank, an unprecedented vaccination programme. Derbyshire is pulling its weight in this. There's no two ways about that. We are. You know, we've gone to a running start on it, initially in our hospitals and now increasingly in our communities through local vaccination services through general practice. So a really positive position. We've done thousands of vaccines so far. You'll see across the Midlands, there's been a report come out, data shown today from national colleagues, setting out the Midlands is doing comparatively well in this, and we're playing our part. But it's a massive programme to do, and you know, all colleagues' support on the patience required for us to get through, but recognise the local ambition to get there as fast as we can. The arena, just to alert colleagues, the arena is a special case in point because we've done something very, very innovative there. Which, when you do something innovative and slightly different, it brings different challenges, but it is innovative. So we've brought together the 5 primary care networks that Derby City would have to deliver the vaccine, and we've put them in one place at the arena. The arena, we're just waiting for final confirmation, but will also go live as a vaccination centre, and we're hoping that will go live on the 25th of January. That used to be called, in old parlance, a mass vaccination site. We now call them vaccination centres. And so, you know, towards the end of January, we will be motoring through really significant numbers through that site, and it will be just really, really good. I think if I can ask for your support, yes, we recognise, like many parts of the country, when you're starting something like this, there will be challenges, but your support in the conversations you have is just really, really important to us, because we need to build public confidence in this programme. We will get it done, and I've no doubt about it. So happy to take any specific questions about the arena, the rest of the vaccination programme, and I'll certainly answer any that I can. Thank you.
Lucy put something in the chat box. Did you want to say your question, Lucy?
Yeah, certainly. Thank you, Mel. There's been talk in the paper about the second vaccination being delayed further beyond the 3 to 12 weeks. Do we know anything about that? Is it just a rumour that's come from nowhere, or is it likely to happen? And what would the implications be?
So at 19 minutes past 1 on the 14th of January, I've not been advised of any change in the vaccination programme. I've not heard of any change from the current 12-week recommended timeline, and of course we will keep live to any changes in recommendations. The recommendations come from the Joint Committee of Vaccinations and Immunisations. That's where it's discussed. It's then recommended to the country through the Chief Medical Officer. So that's where to look, and that's where I'll be taking my steer from. But I'm not aware that the JCVI has changed its view, nor that the Chief Medical Officer has instructed a different approach at now 20 minutes past 1.
Rumour then.
So far.
And I think a plea from general practice, we're trying to ring, as soon as we get allocated vaccines, we get told we've got so many patients we can ring. Patients are constantly ringing us to say, when am I going to have my vaccine? And that's actually delaying us contacting the patients to say, come and have your vaccine. So if you've got any ability to social media, to talk to people, you know, in your areas, we will be contacting everybody in the order of the the vaccination group. We're sort of strictly sticking to that, so we can't change it. So if you're 79, unfortunately, you'll be done after the 80 plus year old patients. And I know everybody wants to have it, but it's actually delaying us trying to get patients in to have the vaccinations. But the patients that have been coming to the Derby Arena, they've not been out for 9 months, a lot of these people, and they've been having a really lovely time seeing people, meeting health professionals. And as health professionals and also the admin, we've not been seeing our patients. We've had lots and lots of conversations with people on the phone. We bring them down, but we see them for the least amount of time because of the risk. So it's actually really lovely from both sides to work there, and also for the patients to have that human contact. So it's doing more than the vaccination is giving at the moment. Has anybody else got any questions for Robin? Or
yeah, can I ask a question?
Yeah.
I understand there is going to be a list of priorities, and quite rightly, those people who are at highest risk need to be treated first. Could you give us a quick rundown in terms of the timelines, in terms of when do you expect to finish dealing with over 80s, and when will you start dealing with people who are between the age of 75 and 80, 70 and 75? Just a quick rundown so we have got some idea in terms of how quickly we might be able to get through to general population with no priority needs as such.
I mean, Robin might be able to answer this, but certainly from a manpower point of view, we will do it as quick. We will provide the staff, and that will be a priority. The limit is the vaccine being provided. So I don't know if you've got any information on that, Robin, at all. Or Chris.
I was going to say, Chris, is it your question? I think.
Yeah, yeah. So it's not as easy a question to answer as you might think. What I will say, because the reason it's not as easy to answer as you might think, is that we absolutely know what are our patient numbers to go through in each of the top 4 cohort priority areas. So we're working on the top 4 cohort areas, and of course we've got varying numbers across the varying sites across Derby City and Derbyshire. What I will say about it is our plan, and our plan looks very robust, is that we will deliver the vaccinations to all of the top 4 cohorts, and we are ambitious to do this by the 15th of February. So 4 weeks from now, we will have worked through them. Of course, we are working in priority order, and you remember care home residents, care home staff, over 80s, top 2 groups. In that, and we're working through them. There will always be some overlap, so it won't naturally say, right, we're going to do the over 80s first, and we're not going to do any other groups till then. It won't work like there'll be crossover of those groups. And so the best way to say is our deadline that's been set by the Prime Minister that we are working to, 15th of February, all 4 groups. And the plans that I've seen give me confidence that we will do it. But as Meryl says, that is subject to supply. Of course, it is, and other logistics. There are lots of risks in doing that we're managing. But that's the timeline. That's the timeline, Councillor Hussain, I am working to.
Chris, just give me a quick reminder about those top 4 top priority cohorts are. And then I can work out something for myself.
Yeah, certainly. So you've got the you've got the over 80s, you've got the care home staff and care home residents, you've then got the over 75s, and then you've got the over 70s to 74s, and in that cohort is over the age of 16, any patients that are clinically vulnerable. So those are and of course the health and care workers as well. So you can see that's a big group to get through.
I think one of the areas that we're having problems in general practice is that the patients who are over 80 who aren't housebound but then don't want to go to Derby Arena. So that will be very much reliant on us getting the Oxford vaccine. And I'm sure that will be facilitated, but there are quite a number of patients who don't want to travel that far for all kinds of reasons. So I think it's just the logistics. The staff are ready and waiting. People are putting in all the hours that are needed. But I've got a question from Danielle Lynn. Do you want to come in and say that question, Danielle?
Hi, yeah, thank you. Hi, yeah, I just wanted to know if patients of the appropriate age group at the time that are being discharged from hospital are being vaccinated on discharge.
On the assumption that they are well enough to be vaccinated, because obviously lots of different patients are admitted to hospital for lots of different reasons, and on the assumption that they are well enough, yes, they are, and of course they're being captured in other settings as well.
Does that include discharge to care homes, Chris?
Yes, yeah, Gavin. Yes.
Yeah. So the answer is yes. I mean, if it's clinically appropriate, then we will offer the vaccination to people who are being discharged who are over 80. What we're also trying to do is people who are attending the hospital for outpatient appointments who are over 80, we're also trying to, where we can, offer them an appointment as well. I mean, to date, we've done about 1,300 patients who have just opportunistically already been at the hospital. So we are trying to do that. It's but it does depend on the clinical appropriateness. I mean, clearly if somebody's being discharged from the hospital, they may not, be a perfect candidate to have the vaccine at that particular moment. But that's what we're trying to do.
Okay, thank you very much.
Are there any more questions for Robin, Chris or Gavin?
Hi, Meryl, it's Hardy. I put my hand up.
Oh, sorry, I missed you.
I wasn't sure whether you were able to see the hand signs. All right, Hardy here. Yeah, Chris and or Gavin or yourself, Meryl. Chris, following on from what Councillor Freether Sain asked and your response, which was that we are well placed to meet the schedule that the Prime Minister set for mid-February on the priority groups that we've just been talking about. And of course, we need to go further beyond that, but that would be a really good milestone to reach and achieve, not just here in Derbyshire, but across the country. What does that mean? Because in terms of the biggest issue is about the lockdown and how long we need to sustain to suppress the potential to spread the coronavirus. What does it mean for that, and how long, how does that fit? Because, for example, even from mid-February, you're looking at 2-3 weeks before people get immunity in the last batch that goes through. And then what does that mean? How does that play out in terms of looking a bit further ahead than that, meeting those timelines and schedules?
Goodness me, Hardil. I mean, you're asking very big questions above my pay grade.
I'm sorry.
For sure, but I'm going to take help with. Yeah, I was going to say that, quite right too. I'm going to bring Robin in to help me with that. But I mean, we're going to be. I mean, this is being. I mean, quite rightly, this will be a government decision about the review of national lockdown. What this means in terms of the most vulnerable being vaccinated, what this means in terms of the effects of lockdown and the spread of the virus, and we're going to have to await the government's view on that as they review. But let's bring other colleagues in for their views.
If I just add a little bit more to it, Chris, it's about what we can do in Derbyshire about the messaging because it's a natural behavioural thing about saying, oh, the vaccine's here, the vaccine's on mid-February, the most vulnerable, and we start to relax. And it's that messaging we talked about, collectively getting a message out about still being careful, protective, and doing all the things. Face masks are not going to disappear just because somebody's been vaccinated. In fact, it's even more important they wear all those sort of messaging things that we could sort of try to coordinate as a health and wellbeing board here in Derby and in Derbyshire. That's what I was trying to get at. You know, we need to sort of find a way to sort of get that conversation and that message just to be going out. And I'm more than happy to do that as a police and crime commissioner from a policing perspective as well. So that's the reason behind that question. Yeah.
Really important. Robin, yes, of course.
Thank you. So I was just going to observe really that vaccination is part of the answer to what we need to do. The first thing to think about is actually the things completely out of our control, and that's the weather. And as we move through spring, we get an advantage purely from the fact that we are moving towards spring in the seasonality of the virus. So that gives us a little bit of a head start. And as we move through that time period, we'll have more individuals who are vaccinated. What we don't understand fully at the moment is what the vaccination of an individual does in regards to spread of the virus. So we don't know yet whether an individual will, although not become ill or severely ill from the virus because they've been vaccinated, we don't yet fully understand whether they can carry it and spread it on to others. If we have a vaccination that prevents the carriage and spread of the virus, then the more people that we get vaccinated, the more and the rapid impact that will have on the spread of the virus, which will be incredibly helpful for us. But we have to remember, even with those conditions where we have really good uptake of vaccination, we still get outbreaks and occurrences of those diseases. So we think about flu every year, but we can also think about other things that crop up, such as mumps and measles that we have occasional outbreaks from. So we have to remember that the key ways of preventing the transmission of coronavirus are really important, always really important for us to remember. So that's about reducing the number of people we have contact with, and about that social distance, covering our faces and washing our hands. And those things are going to be with us for a considerable time as we manage the virus. Hopefully, as we go through the spring towards the summer, a lot of the other national restrictions will be able to be moved away, but we still need to remember those personal things that we need to do to prevent the spread of the virus.
Thank you. Has anybody else got any other questions? Want to ask Robin or anything else?
Gavin had his hand up, and then if he's
Sorry,
just come in
Gavin.
as well.
No, that's okay. I just thought Howdial raised a really good question, and I was probably going to say what Robin's just said, but she said it much more eloquently than I would have done. But it's this. I think where you were going, Howdial, is this is probably going to be a longer haul than we think. I think a lot of people are thinking, well, first dose, 3 weeks, 12 weeks, second, and all that sort of stuff. I think it's going to be a longer haul, because I think even if you've had both doses and you have some immunity, you know that doesn't mean no vaccine is 100% effective. It doesn't mean that you might not have it, albeit with diminished symptoms. You still might be spreading it. So I think PPE and social distancing and all of those things will be with us for some time to come. I mean, interestingly, I did a call this morning with about 100 of my own people who are about the vaccine, and quite a number of those were shielded colleagues who are at home, and they're desperately hoping that if they have their 2 doses, they'll be able to come back to work. But that's not the case, because we can't even following vaccination guarantee their safety. So I think it will take a number of months before there's sufficient immunity within the population so that prevalence is at a sufficiently low level that we can start to make some risk-based judgments about getting back to normal. So I think where you were going was that this is probably going to be a longer haul than people think. And I think that's absolutely right.
If I may, if I could just come back on that. I mean, I think I thought that would be the answer, but I just wanted people more expert than myself to actually say that. And I think that has implications for how we as the Health and Wellbeing Board and each organisation, how we coordinate that message, and to start doing that now. And I think that's something that should be an action that we have from this meeting to say, well, how do we get the messaging right in the way that Robin and Gavin just articulated, and then how do we make it simple enough for us all to be able to say it and repeat it, because it's going to have to be repeated quite often to get people's focus and attention maintained in terms of safety and protecting themselves and protecting others. And that'd be something that I'd want to be advised and given information so I can push it out through my communication, as well as others doing that or doing it jointly as well.
Sorry, Montana, did you want to come in and say something?
If that's okay, I was just going to add to the sense of doom really by reminding colleagues that whilst we're talking about the the delay from community transmission to impact on hospital, there's a further delay to the impact on the mental health and well-being of our population, which lags even further behind that. And actually some of the very worrying statistics that are coming out of the ONS about the well-being of the population, the sense of hope, the sense of happiness, which despite the vaccine is actually still deteriorating. And we know that is likely to convert into more serious mental ill health problems. So again, I think getting through to a position of having reduced community transmission isn't the battle that we need to be. That's not the end point. The end point is that elongated impact that the pandemic's having. So just didn't want us to lose sight of that impact as well, Meryl. Thank you.
And I think the things that sort of grieving process, a lot of patients haven't grieved for their loved ones at the moment because they've not been able to. So I think there are lots of things that are going to be happening with their mental health. So does anybody else want to come in?
Meryl, Rachel put something in the, I would say to Rachel on that, if that's what's happening, I'm not hearing it sufficiently loudly enough, and so we may need to sort of see how we can do that, because the Resilience Forum has done lots of really good work, and it's good, but some of that messaging, maybe it needs accentuating, because I'm not hearing that as loudly as it's being said, if that's the case, Rachel, on that point.
Kim, did you want to come in and say something?
Yeah, just a quick one really to add to what Ifti's just said. I think I was at the Stronger Communities Board, the Derbyshire one this morning, very much talking about health and wellbeing, but also physical health. That there are lots of people out there that haven't been able to get down to the shops, particularly older people. And there's a real concern that there's been a real drop off in some of those more vulnerable groups and their physical health as well as the mental health. And that's something I think we haven't particularly been thinking about either. So I think those will be really important things to start getting worked into the recovery plans as we're moving forward, and that communication, as you say, Hardale.
Yeah, and I think, certainly talking to patients, some patients haven't left their home. So I think some of the older people will be frightened about leaving the home and physically not being able to walk as far. So they will have aged a few years just by sitting at home. Alison, did you want to come back in and say anything? Or?
Yeah, certainly. And if it's related to vaccines, I'll pick up Danielle's question in the chat box around care homes as well. So if I do the latter first, in terms of care homes and care home residents and staff, we're making real progress across Derby and Derbyshire in getting our vaccination into our most vulnerable, which in that top 4 includes care home residents and staff, where comparatively doing well. We've got coverage over sort of 25 to 28%, varying where you are in county and city. So we're doing really well, but more to do, and we will get through that cohort really quickly. There's a national imperative that we try our best to get that done by the end of next week. So, you know, no lack of ambition in our system to do that. If the question's about care homes more generally, then Rachel might be able to help as well on that side. But hopefully, Danielle, I've picked that up. Just the question I was going to raise, it's not a question, it's a comment, is I have a similar conversation in lots of different forums, and so there is a really important question around the Derby City Outbreak Engagement Board, which has got a statutory role in some of this conversation, the statutory role of the Health and Wellbeing Board, which is quite rightly interested in that, and the emergency response statutory function of the LRF are all really important, but we could do to coalesce some of those views and some of the outputs, I think. And if we could, I'd be grateful. And I suppose it's a sort of, Robin, unfortunately, is probably one of the linchpins with Alison in some of those conversations. So if we could offline do a bit of streamlining, I for one would be grateful.
Did that answer your question, Danielle?
Hi, yeah, it does in relation to the vaccination. So thank you for that, Chris. But yeah, I would like to know where we are in relation to the virus, if possible, in relation to care homes, because I think there's some concern within the community that it's starting to get back into care homes. So I don't know if Robin could answer that. Thank you.
Yes, very, very happy to. So I think in Derby City, we are reflecting the picture that certainly I'm aware of the picture across the East Midlands, and we're certainly reflecting that picture. And what we see is, as the rates of cases within the community start to increase, we start to see that increase of cases within care homes as well. And our general understanding of that is that as people move in and out of care homes, as in the people who are working there, there's just that increased risk of taking the virus in with them when they do that. And there's so many more measures in place now to protect the staff and the residents around the care homes. There's regular repeated testing of the staff and the regular testing of the residents, as well as the they've been working with the PPE now for many, many months. So I think confidence of what to do is much greater. But as the volume of the virus in the community increases, there is always that increased chance that it's going to start to enter into the care homes. But as I said, we're reflecting what's happening across the East Midlands. We look very similar to that pattern.
And Devin's put in the chat box about UHGB vaccinated over 3,500 of the care home staff, which is, yeah, tremendous amount. Has anybody else got any questions, or are you happy to move on?
Just Meryl, if I can, I'll just need to help colleagues on possibly the minutes of some of this stuff. So given some of the data challenges and restrictions that we have nationally on this. So if I could link with Karen, I'd be grateful, just to help on the minuting side of some of that.
Yeah, that'd be really, really helpful. So if you're happy, shall we move on to the draft Derby recovery plan? I think, are you leading on that, Rachel?
Yes, thank you, Meryl. I mean, clearly not to detract from any moment on the immediate response and the emergency that we just talked about and that picture, but start thinking about, you know, what after COVID, what is the recovery priority for us as a partnership? And the partnership board, working with obviously all of us organisations and broader, have agreed a principal recovery plan, which has sort of three main strands to it. One is an economic recovery, looking at the unemployment, skills, you know, business growth issues and critical issues there. And one is organisationally, all of our organisations needing to recover and to rethink about how we operate as organisations in a very different world. And then a third strand is our community recovery, so the health and well-being of our population coming out of COVID. So what we're going to talk about, and Kim and Harper and I are going to do this together, and Carl Tringworth is also on the call in some more detail, is talk about two initiatives that are coming from the community recovery strand. And one is about how we work in localities and learning the lessons we've had through the pandemic so far and making sure that becomes cemented for the future. And the other is about a programme around well-being, Brilliant Derby, and I'll come on to that afterwards. So just to start off with then, is going to present, this is why I get clever or not, a presentation on Better Together, which is our approach to locality working to attempt to really learn the lessons. Is that coming up?
Yeah, that's on the screen.
On screen, excellent. So Better Together is really about how we've learned some of the key lessons about how we work as a system around supporting neighbourhoods and communities at a local level. So I'll just explain some of that, and then Kim will speak about some of it halfway through. So just really, really clearly, contextually, this has been an incredible, last year has been an incredible challenge to everything, every system at a global level, every relationship, every organisation, all of the issues around the economy and our society more generally. So a real sense of incredible challenges to the world, if you like. And what we've learnt through that time, particularly around Derby, we have learnt something really powerful. I think probably we all knew it before, actually, but we've really had it reinforced over the last 10 months, is the power of community, the power of people at a local level coming together to sort things out, to do things for themselves, support each other, their neighbourhoods, their neighbours, their friends, family. The sense of the power of community to do things, to make a difference, has been absolutely palpable all the way through this in the last 10 months. And we've also learned something, again, we probably did know before, but I think it's been reinforced in ways you probably couldn't have imagined, is that we need to work together. And I think as a system, the public services is a complicated mess of organisations and different priorities and different boundaries and different interests. And that really makes things complicated. But actually, when you get to a point where there's an emergency happening and the house is burning down, we've managed to cross those boundaries, reduce those silos, work collectively to do things to make a difference because of that community priority. And that is a really, really important lesson we have learnt. We've done it in the fire. So how do we hold on to that? So really the Better Together programme and initiative is about how we take both those two learnings and we make them sort of permanent changes about how we operate in localities and neighbourhoods in Derby for the future. Because the challenge, and we talked about this very early on before the meeting started properly, the challenge of community recovery is going to be immense. We've never really been in a situation before from a societal point of view of facing the combination of impacts that we're seeing in our place, in our lives. So the level of unemployment and business failure, real concerns about the end of furlough and what that might mean, the increase in debt and financial exclusion, and recognising this is on top of an existing economy that was quite, differential around those on 0-hour contracts with very little security in their employment situations, struggling. Everyone, there's a whole issues around national statistics which show a large part of the population being, one paycheck away from homelessness. So a real sense of the fragility of our labour market prior to COVID. So the impact of COVID on top of that, really quite a concern. And, naturally, some of those pressures that are put onto people's lives, really being seen through around increases in domestic violence, issues around family breakdown, and all of the impacts around that, around physical and mental ill health. So the challenge that we face as a system to try and deal with some of the impacts of that reality is, is unprecedented and is extraordinary, not to overuse those words. And as I said previously, the way we run our public services in this country, and it's nobody's fault, no one designed it from a blank piece of paper like this, is extremely complicated. This slide I use a lot because I think it really describes how it looks. And I think many of us on this call who are intrinsically involved in public services, who know how the system works from the inside of that mess of spaghetti, we still find it complicated to navigate our way through who does what in this system. And if you think about it, we find it difficult, the population as a whole finds it absolutely extraordinarily difficult. And we really need to find a way of just trying to unpick that wiring, sort it out, make it make much more sense for people locally, so we can actually marshal all of our resources effectively to deal with the challenges that our community recovery is going to bring. And also a real sense of the way we work needs to be different. And I think I would not be unfair to say that in the city we have worked over the last 10 months really well in this way. We haven't been a system that's told people what to do, being very punitive, being very much high challenge and very low support. You know, you see what the rules are, abide these rules. And we haven't, I think, either worked in the other way. Often people work in public services is to be very permissive and do things for people and take power away from them and not give them their own responsibility. We have worked in that orange box on that chart with people. I think the only opportunity we have as a system to really support what needs to be done around community recovery is to work alongside the talents and creativity and capacity and resources of our people in this city. We work alongside them and all of those partners and marshalling all of those partners' resources to go to do that. So working restoratively, working in an aligned way is a really important foundation principle of how we want to work. And this is the Better Together project is based in that sense. I'm not counting the slides now, Kim, so I'm not sure if this is yours or my slide, but is this mine or yours?
I guess it almost feels like it's both of ours, Rachel, because I think it always is.
So I'll do this last one, then you do the next one. All right, okay. Sorry, that was very seamless, wasn't it? Really apologies, colleagues, for that. So just in terms of the practical, the community hub, our response as a system to the emergency around our population, particularly supporting them with food and medicine delivery and all of that support we had to put in place very quickly for the clinically vulnerable back at the first wave. We did that absolutely as a shared problem. It wasn't a city council problem, it wasn't a volunteer committee, it was the whole system. How do we do this and how do we do it with the city using all of those strengths and assets that already exist in our city? So we did it around locality. So we had a real set of locality-based neighbourhood teams that reflected the differences in different communities. So the way it was done, there was a structural approach to it, but it was locally different based on the local communities, local organisations, and the flavours in those characteristics of particular places. We did break down silos. I mean, inside the City Council, I can say, yeah, absolutely, we broke down silos between adult social care and children's and housing and customer services and this whole range of services working in a completely different way than they have before and organisationally. We recognised the really important role of local councillors. Local councillors are the eyes and ears of their communities. They are fantastically well networked in the local communities. They know people and who does what, the movers and the shakers, and using their knowledge and their intelligence was really fundamental to be able to get the right sort of responses in those different localities. We simplified access points for citizens. You went to one number and it was triaged through one number, nice and simple, no complicated going to different organisations to make that really seamless. And we really worked on understanding the outcome and the problem we were trying to solve before designing a solution or a service for it. And that's that whole thing of working restoratively, not going in thinking, I know the answer because I'm the public, so I'm the council, so I know what the answer is going to be. Here you are, actually working on what is the problem with with the people who we were working with, and we empowered and citizens themselves. I think really important residents, but also colleagues. We liberated, I think, I would say from a city council point of view, some of our teams outside of their silos to just work on the problem and work with people in locality, and that was a really fundamental principle of the work that worked really well. And I'll go on and I will hand over to my colleague Kim Harper, who's done all this absolutely in tandem. It's been completely a joint project.
It has, and I think to pick up on what Rachel said, for us the community hub approach, which started as a sort of almost that rapid response to such a challenging issue, has become firmly embedded in terms of how we believe that recovery needs to happen, and it needs to happen with people, and we need to recognise as part of that. And this sort of hierarchy was something that the local area coordination teams originally put forward, and for us it was like absolutely right. It is about empowering the citizens and the colleagues. So we started off with volunteers and talking about volunteering, and actually to some degree we've moved on from there, and actually we're saying yes, it's about volunteers, but really it's about good neighbours. It's about what can you do on your own, what can you do with the help of friends and family or your neighbours, then local voluntary and community sector and locally based community coordinators, LAC teams, and really not providing that traditional help, recognising actually that if we can create community solutions working with people, then what we aim to do is have less people going into those higher level, more expensive, formal services that are out there. So we recognise that in some places this is working really, really well. And what we've tried to make a fundamental underpinning part of the hub is that it should be about what people can do for themselves. And that's how we'll build community resilience, and by empowering the good neighbours and getting people to help each other. And we've really seen that. Last week, actually, for the vaccinations, I think a really good example of this is that we'd had a call to say we need some more volunteers for some shifts. So we put a call out to the COVID-19 mutual aid group through our social media organisations, reached over 11,000 people and had over 100 calls the following day, people wanting to help. And actually it's that doing that together, but then also capturing those good neighbours and that goodwill so that they don't get lost within the system. I think that can really easily happen if we don't work together. So that's probably it on that. So I could go on forever, so I'll stop there. And
do your be Chris Whitty and just say next slide, please, and I'll do it for you.
I was trying to think of a good transition there and couldn't. So creating the environment, and this is a slide that Rachel used actually at our AGM last year, and it was really, really welcomed, because it is about, at the end of the day, local authority are the stewards, the connectors. That you're not to be playing on the pitch, and you said it much more eloquently than me, Rachel. So if you could pick that one up, that would be really helpful.
Okay, I think it's just recognising that, public services, we get into a mindset where we think we are in charge of everything and we can fix everything, and we mean very well in doing that. But actually, our job, particularly in City Council, is to create the environment for other people to play. And actually, we should make sure that the pitch is safe and well laid out and cut properly and lit to play on. But actually, people who play on that pitch are often people in the community, their own residents, their own people, the organisations. And if we can find ways of navigating that complicated wiring, being much more connecting good things to good things across the city and across those systems, and being a facilitator, that is a really critical role that we can play.
And actually, again, another really good example of that is the shot tower. And that's going to be a shared resource, and we're going to be working from the shot tower just opposite Council House, right in the middle of the city. But that isn't a resource for community action. That is a resource for community action. We'll have the council teams, the local coordinators able to work from that. So that central hub of different organisations supporting local communities and that delivery is exactly how it should be going. So you get that local intelligence and you work together to devise solutions, and that for us is what's gone really well over this period. Yeah, Karen.
Shall I do this one?
Yeah, that's lovely.
So I think, and part of the thinking here, and particularly from a public service point of view, is how do we empower our people to think differently? And how do we really make the environment effective to allow them to be much, much more collegiate, more connected with other parts of the public service, and much more working alongside people. And that takes a bit of capacity and a bit of effort, because actually we've trained people to think I'm a particular function and I'll do that function. I'm a social worker, or I'm a house engineer, or I'm a nurse, and I just do that thing. We're trying to say actually you need to understand what's around you and find ways to actually connect them together and what is it, architect systems. So very much changing the mindset of some of our teams and how they work. So not being paternalistic about their relationship, really start looking forwards about how you can find solutions and be much more creative about some of that, and not focusing on services, but focusing on empowering people to do the right things, and working, as I said, with people, working with and not trying to do things for or even be doing things against. So we are, as part of this programme, looking at an organisational development strand about how we help our teams to work much more in this, what is an InlaGov picture there from the 21st century public servant work that was done a few years ago in the sector, about how do we get teams to have these skills, that can navigate systems, they can architect complicated systems, they can weave resources around, they can tell stories, they can build relationships, they can network, and they can build and broker partnership. Those are the skills we really need in this sort of way of working. Go on, Kim.
It's actually really simple, isn't it? It's about simplifying public services, and Chris, what you've just said there as well around bringing some of this together, all of this really good stuff that's come out, and all of this really brilliant intelligence. Actually, it's how we make sure that we work together better. and share that resource. Needs to focus on place and locality, different solutions for different communities. So Normanton and Arboretum, the local solutions there are going to look very different to what we would need to be working on in Elveston or in Derwent. So actually working with those local community-based opportunities, people, resources, the local councillors, and our good neighbours within those areas, making sure that we focus what we have on the needs that are identified there and work with people to solve them. Because at the end of the day, I think communities are best placed to know what those needs are and need to be involved in working that through. We see this reducing traditional demand, absolutely, because if you have empowered communities that are making better choices, that are working together, even given the challenges. So one of the things that certainly from a recovery partnership perspective we're looking at is community anchor organisations and the health and wealth agenda. And that's really important in terms of trying to make sure that we work with local businesses and create local vibrancy. The businesses have been amazing through this, working with the hub, local taxi firms, different food organisations and local businesses across the city have really risen to this challenge through their corporate social responsibility agendas as well, and reducing that demand on those higher level services by helping people to support each other in the work. Very much see this as linked to the stronger communities work that we are doing in the city as well, which is 2 years now we've had the Stronger Communities Board, and that has been around local leaders and around local leadership. It's cross-party in terms of support as well. So we have councillors represented there, university, Derby Homes, local voluntary and community sector organisations as well. And we're actually looking at that structure now and how we strengthen it and how we can make sure that we're bringing through local leaders. So for instance, I know that they're looking at forums down in Normanton working with Community One. We're looking across the city as well. So for faith leaders, and I'm working with the Multi-Faith Centre to make sure that the faiths are coming together as well. So really, we see that whole picture of being really important in terms of recovery, and we're very, very keen to make sure that that's linked into the primary care networks and to the Place Alliance, and that we're really joining up that work, because that's how we'll think that we'll get those better outcomes. And we are Team Derby. The email I sent out thanking the volunteers, I'd actually put hashtag feels like we are Team Derby, and we are Team Derby. It's for all of us to really be making sure across our public services, business, voluntary organisations, cultural institutions. I do think Derby can be different. I genuinely believe that. The response has been amazing. I think as a city, we're as impacted as many other places, but actually we've retained hope, I think, and that's been partly because of the approach that we've taken in the city. Quite a large part, I would suggest.
Carl, do you want to do this last slide?
Yeah, definitely. I mean, I think you two have kind of covered everything really well. So I guess really it's the next steps and what does that actually look like? And I think what we're really keen to say is this isn't just about changing people's job titles. I think Rachel said this is about actually repositioning some of our resources and realigning them, and actually in some respects encouraging our staff to start looking at things through a different lens. But obviously that is going to start to look different in neighbourhoods and localities. So our key thing is moving towards the locality model. So that's not to be confused with our early years. It's building on the successful work we've done around neighbourhood working for over a decade. It's reimagining some of those work streams, but more importantly, it's about clearly defining who the new team is. So we talk about Team Derby. Well, we need to create Team Chaddesden, Team Derwent. We need to have those recognised teams. And for councillors, I think that's going to be fantastic, because it's almost you have one team, and that team is multi-agency, multidisciplinary. It creates a local melting pot of different areas of expertise to create local solutions to local problems, and all of this is underpinned by a really strong framework with, like Kim mentioned, the shot tower as the central hub. if you like, that hub and spoke model. And I think, you know, we'll, as councillors and colleagues, we're going to start to see that really emerge over the next coming months, where things start to look different and feel different. Ultimately, we know that the emergency response framework that was co-designed with the voluntary sector very much in the driving seat back in March, April last year really worked. And it's what can we do now to retain that positive relationships that have been established and to keep it alive. So we're going to be looking at, projects that have already kind of been successfully sustained from an emergency model include, for example, Food for Thought. So most people will have heard of Food for Thought back in March, April, back of an envelope with the voluntary sector, you know, kind of devised a very, very robust but really good system for ensuring that we had an emergency food system in the city. That has now become the new norm, and that has been embedded through the Food for Thought. The shot tower is another move forward as well. And the model, the better together approach, because that's what it is. This isn't about just changing a policy. It's about hearts and minds and getting people to understand it's better to work this way, because ultimately there's better outcomes for our residents if we work this way. And already we're starting to see new initiatives emerge that have adopted that approach. So, you know, just this week we'll be having the first conversations around the Derby City Poverty Commission. Again, that's very much led by a collective of people that sit within the community, not by the council, and also contextualised safeguarding, which is so critical and crucial for our children, young people. And yet it's always felt outside of most of the work streams that we've done. What locality working gives us an opportunity to really attach a number of different priorities, but in order for them to have those local flavoured approaches to tackling the problems that those neighbourhoods face, instead of a one-size-fits-all.
Thank you, Carl. Thanks, Kim. That's helpful, colleagues.
So is there anything else you want to say, or shall I open it up to discussion?
Probably best to do discussion, and I can do the wellbeing programme afterwards. That's okay, Mel?
Okay. I mean, certainly I found that really quite exciting, and amongst the gloom of COVID, a very positive sort of presentation. And from the patient's point of view, the volunteers have got more out of it than they've put in. So you're not only helping the people that need the practical and the emotional help, you're also helping the people who didn't think they needed it in the first place. So I've certainly from patients, the feedback we've had is they found it very positive. A lot of them have been furloughed or unemployed, and they've never expected to be in this position yet. Actually, they've really benefited. They've found a purpose. There's a reason to go out, and it's been really valuable. So capturing that and going with it, I think, is really exciting. Has anybody got any questions for the team? Did you want to say something?
Yeah, if that would be okay. I mean, it's brilliant, and you know, I was talking about hope earlier, wasn't I? And this is hope, and in the approach that we're taking. I suppose the bit that I was struck by is the thing that COVID has given us, if I dare say it's given something positive, is it's given us something to unify against. You know, it's given the community and citizens that sort of single purpose. And if we are going to recover in the way that we're describing, and I love that sense of one Derby, of Team Derby, we need to find, well, what is that single purpose going to keep being going forward, and how do we keep that single purpose going forward as being not some sort of organizational jargon that is important for organizations but is meaningful for people out there in the community, and I think harnessing that will just have such a massive impact on the sustainability and how well something like this lands in a time when, you know, let's all hope that COVID isn't that unifying force.
Sorry, unmute yourself. Hardy wanted to come in, and then do you want to say something after him, Lucy?
Okay, thank you. Thanks, Meryl, and thank you, Rachel, and Carl and Kim for that motivationally uplifting message about everybody being together and Team Derby. And I think that's really, I'm 110% supportive of it. The point you made, Rachel, about the council being an enabler of preparing the pitch, looking after the pitch so that people can play their fullest potential is really good metaphor. But I think the one thing which I would say, if we're going to sustain this, if it's going to work, is that, as Ifti said, we need to harness the energy that's here now because of COVID, because their backs were against the wall, they were isolated and they wanted to help. But how do we sustain that? And this reminds me of a couple of things, really. First, I opened up a vulnerability fund as the Police and Crime Commissioner to communities in Derby and Derbyshire to apply with innovative ideas of what they want to do. And that reflected what you're saying. There's a great resource, energy, innovation that exists in our communities up and down the city and the county as well, across the piece. But I offered up £250,000 worth of application funds. I got something like £800,000 worth of applications, and I couldn't see many which were not suitable to be funded. So sooner or later, and same with the food for thought. It's not gonna run by itself. There is an issue about funding, and historically, not just in Derby, not just Derbyshire, across the country, because of the challenges local authorities have faced, funding for voluntary organisations, and Kim is a good example of how she's had to morph into an organisation which is different now than it was a few years back. Funding is also an important issue, and then the City Council, yes, preparing the pitch and enabling to unleash the potential of our citizens is I support that 100%. There's that second element about how all of us, Police and Crime Commissioners, commissioning, mental health and health services, the City Council, how do we sort of harness the potential to get that, enable that sort of those voluntary organisations, those communities, groups to really function. There's a lot of opportunity they've seized, and they do with a little bit of help. But to sustain it longer term, we need to have that strategy built into the vision of Team Derby. And just value your thoughts on that and how we can take that step, because otherwise it will not sustain very long. We'll get the early wins, we'll get all the coordination, everybody talking and joined up partnership working, but to sustain it, we will need to sort of think for that next step.
Yeah.
I was going to say, I think we've got various prongs to that approach, Hardy. You're absolutely right. It needs some funding. I think that the two things straight off the bat that I can think of that we're trying to plan in is the whole idea of anchor organisations building the local economy and looking at how we commission services differently. So, for instance, the Youth Alliance in the city, that came out of the Stronger Communities Board. And rather than going out to contracts and going through a whole commissioning process, what's happened there is that team of voluntary sector organisations have worked with Sue Ann Lim and the children's team, and they've designed a programme to meet needs without having to go out and then compete for that. It's like, actually, this is a need. This is how we can fill it, local authority. And then the local authority has put their trust in those organisations to deliver it. So it's about identifying who's in the right place and able to deliver. And I also think this, from a sustainability point of view, certainly Food for Thought is looking to open community shops. And the benefit of doing that, from my perspective, is that at some point, and we're not there yet, I get that, I should be able to go into that community shop and maybe pay a bit more for something. But then somebody that would have had a food voucher, for instance, or it has much less to spend on food, could go into that shop and is given a bit more dignity and choice and food parcels for us should only be the final, emergency response. Actually, we're looking at community shops basically through Food for Thought as well to aid with that sustainability. I think it will take time, and I think that there will need to be support, but those are two immediate things I can think of that wouldn't have happened, I don't think, 2 years ago, but now we're genuinely looking at and making happen.
Thank you. Lucy, did you want to come in and say something?
Yes, I would, and thank you for that. And I think this is a really positive way of looking at things. And I think another example I would draw in there of public sector coordination of multi-sector responses would be on homelessness and the work that Derby Homes has done on that. But I would say it's going to take time to achieve this, and as well as making use of existing public sector coordination, there will also be entrepreneurs within the community. There'll be community entrepreneurs, and it's going to be a challenge to identify who they are and bring them together. And particularly at this time, communications is going to be an issue. And I'm just hoping that we have the stamina and patience for these newly forming organisations to go through the sort of standard storming, norming, and then performing stages, rather than feeling that everything's going mad and we can't cope and therefore pull things back in. And it's a matter of, I think, keeping our nerve while things are going through. And I just wondered whether there'd been any thought on that stage. And it's going to be over a matter of months in some cases, years in other cases, and potentially multiples of years, particularly because of the impact of COVID. So it's really just a plea. Let's stick with it. Let's believe in this as a way we can do things. But let's make sure that we've got the right safety nets and checks and balances in to enable that growth rather than stifle it.
Can I just make an observation there, Lucy? Because you're absolutely right. Asset-based approaches isn't a new thing. We've been doing it in the city for a long time. And actually what we've seen during the pandemic, the community response, there's been certain components of that which was based on work we'd done previously. And if we pick out individual projects, for example, there's been some fantastic work coming out of Aspire, which is a wrestling academy in Derwent. They've been absolutely at the forefront of our community response. A church over in Allenton just became the main hub of that neighbourhood, and we've seen that all across the city. And I think, it was about us not interfering and allowing it to just continue on its own. That was the key thing. And it goes back to a point Hardil made. This isn't our council strategy. This is the community's own developed strategy for what they want. When they own it, they deliver it, they run with it. And the communication thing, I think we've probably got some of the strongest communication links into communities at the moment than we've ever had in my 20 years of working in the city. And what I'm seeing from that, it isn't us that's developing that or growing them, it's the communities themselves. Each day they keep coming to us, don't they, Kim, saying, we've had an idea, we're going to set up another WhatsApp group, or we're going to set up this blog. And the energy, our role is to sustain that and facilitate it. And that comes from, not giving permission, because communities don't need it, but almost kind of saying it's okay to do that. We do often get people come to us saying, is it all right if we look to do it? And it's about saying, do it. I mean, my mantra has always been, it's been far easier to ask for forgiveness than permission. And in some respects, we're kind of saying to communities, crack on, do what you want to do, and we will support you in any way that we can. There will be a few weird projects, I'm sure, but in the main, I think we've just seen an absolute outpouring of really positive initiatives that have seen us through since March, and I'm sure will continue to see us through the recovery.
Yeah, I think your point about empowerment is absolutely vital. People have been very much done to for decades.
Absolutely.
And to free up that ability to do things for yourself, even it's simple things like picking up litter, some people feel they can't do.
Absolutely, and Lucy, a great example recently, and it's relevant today, was around clearing snow. And historically, some of the the conversations people have had, and actually we should just unblock what those issues are and let communities do what they want to do for themselves.
I think it's really positive. Has anybody got any other questions? I'm aware we're sort of terribly overrunning. Hopefully we'll pull some time back. Anybody got any other questions before we move on to Chris?
You're on mute.
You're on mute, Rachel.
Sorry. Shall I just do Brilliant Derby really quickly then, just so I don't miss that opportunity, because the other project. Okay, sorry, Meryl, about the time, etc.
Yeah.
So very quickly then, Brilliant Derby is another project that's come out of, I think this is the one right version of it, of the community recovery strand. Again, this is more about same sort of general principle, but this is about, can you see that? Can you? Yeah. This is, again, city partnership. Team Derby is always the context, I have to say. This is about how we're trying to think about how we support the well-being and resilience of our citizens, our residents. So it's really about a programme that we're just launching it now, but it is going to build and develop and evolve over the next 12 months. It's absolutely partnership focused, so the whole partnership's been engaged so far, will be engaged going forward. So the university, businesses, culture, launch sector, etc. Organisations in the public service. What it is, it's a programme to try and build personal and collective resilience. We just talked at the beginning of the meeting, and Roy Webb has complete trademark for this. There's really great copyright. It's about a Joe Wicks workout for your mental health. So it's about building personal community resilience, finding tips about how you can be your best self, supporting our residents through now and post the pandemic, and trying to develop a Team Derby citywide movement around positivity. So it isn't about mental health. That's obviously clearly dealt with in other places more effectively. This is about the lower level, the real mental health sort of resilience, your mental well-being. So working in tandem with Dr. Andy Cope, I'm sure many people on the call know Andy Cope really well from the Art of Being Brilliant, who did some great work for us and our workforce over the last few months around supporting our workforce in being the best version of themselves. It's about a set of web-based sessions, so live beaming, like Joe Wicks would do around physical well-being, workouts for your mind, very simple, doable things you can do around things like positivity, purpose, gratitude, strengths, happiness, mindfulness, that sort of stuff. It also includes developing brilliant champions from across the city, so from all of our partners, from our communities, people are already doing things around well-being, so it being an overarching sort of program that encompasses all of those things that already exist. But the idea is about taking the ideas of how you can be the best version of yourself into physical environments, into communities, workspaces, etc. That's the intention. We endorsed the approach at the Partnership Board back in December, which seems like ages ago now, wasn't that long ago really, the concept. We then did a workout session this week with teams across various of the public services across the city, which went very well, and we have created a partnership working group to work on shaping the programme. We're going to be launching it. We've launched it already, but it's going to be launched around Blue Monday for next week. So I want to try and get big media interest in this, because this is about, we're going to live beam stuff out to the city. You've got to know about it to know to actually go on and look for it. So lots of publicity, East Midlands Today on Monday, and you'll see much more press coming out about it over the next few days on the back of Blue Monday, the most depressing day of the year. If you remember that, you can't remember Christmas. Decisions have been broken, all your bills come through, all of that very cold. So quite a good chance to get the media interested. And the idea will be doing start the wellbeing workouts beaming live in March, April, and then continue that over the rest of the spring and summer into the autumn. And just really to be clear, it's a thought approach, it's an overarching brand. Sorry, I get coughing a bit. It will develop and change working with partners and will be shaped by people locally. It is really important we get media involvement, and so all of your network support promote it would be really, really helpful. We're trying to create something as a movement across the city about positivity and how you be your best self, and how do you rise stronger from a difficult time. And it is designed to set some foundations that are sustainable and long lasting. But I'll leave it at that and apologise for doing that quite quickly.
Has anybody got any quick questions or anything they want to ask Rachel about this? thank you. I mean, that sounds really exciting and just what we all need with COVID at the moment. Can we move on to Chris? Sorry, it's so late, Chris. If you could present your topic.
Am I still sharing? Sorry, I can't seem to get.
Yes, it's still sharing. Yes,
I am.
You are at the minute, Rachel, which is fine.
I keep pressing the button to stop.
It just likes it. It's brilliant. What more can you say? There you are. Okay, look, thank you, colleagues, for giving me some time on the agenda, and given these current challenges, it is actually really welcome to just lift your head up and get strategic and just think to the future a little bit. And I think I last updated colleagues in November with regards to Joint Up Care Derbyshire and the integrated care system developments, and when I put these slides together, I wasn't wholly sure which was the best angle to take, but having listened carefully to the conversation throughout from start to now, I'll probably just tweak a few things in terms of what to present, because it flows actually, the point of where I want to get to flows beautifully well from the last two presentations, really, and I think could be really helpful. So what I was going to talk about was the integrated care system developments. I think since we met, or round about that time, NHS England and Improvement had set out their views on integrated care systems and legislation change. So I just want to say a couple of words about that. Since then, Joint Up Care Derbyshire has been given integrated care system status through the national position, and I think that's helpful. And I'll say a few words about that, and then I'll give a bit of an update on where we're getting to in our development, and also but finish, I suppose, on the relationship between Joint Up Care Derbyshire and the Health and Wellbeing Board. So I hope that's helpful. I recognise that for many colleagues this isn't at the forefront of your mind, so forgive me if I put a couple of reminder slides in to start, if that's all right. So just to remind everyone, look, what's the point of Joint Up Care Derbyshire, and remind colleagues that Joint Up Care Derbyshire is the health and social care system for Derby and Derbyshire. It is simply in this sentence to make improvements to the Derby and Derbyshire population's life expectancy and healthy life expectancy in comparison to other parts of the country, because unfortunately we lag behind them, and reduce the health inequalities that are driving those differences. So, you know, it's a long sentence, but it's there in a sentence what we're about. Clearly, we know what the drivers are. You know this, I know this. It's not news to any of us what the main contributors to both death and early death and premature death, but also premature ill health and disability are. You know this, I know this. It's not news to us. Of course, we need to understand what the impact of COVID-19 is on the above, and we will get, you know, we're obviously understanding both the immediate impacts of COVID-19, but the longer term ones. I don't think that it will change those really big, you know, high level areas, but it will certainly influence them, certainly. In terms of what drives those big ticket items, well, you know this, we talked about it last time, we talk about it frequently. 20% of those overall outcomes is driven by health and social care delivery, so the delivery of care. Only 20% is affected by that. So, you know, it's an important 20%, of course it is, but actually the majority of those outcomes delivered by the wider determinants of health, and you know what they are. It's not news to this board for sure, but it's important. On the back of that, though, it drives what my view and the board's view has been on what's the role of Joint Up Care Derbyshire, what do we do? And you know, we've really focused our thought on what's in our gift as a health and social care system and what do we need to influence in others' gifts and in other spheres, really. So, thinking that through, we've got to influence the socioeconomic partnerships that happen, because in that 80%, a lot of it is around health and wealth, health and education, those sorts of things, health and business, got to be influencing there. Health and wellbeing partnerships, getting into that prevention agenda in a much more strategic way, and this health and wellbeing board is what I'm classing there as the health and wellbeing partnership. But of course, there are things we can do in Joined Up Care Derbyshire through our health and social care delivery on that 20%. But in a reciprocal relationship way and partnership way, we can be influencing and working with these different groups, and the end of this conversation is about how we do that. We want to lead and act and influence in all of those different partnerships in a cohesive way. I think it's a fair challenge that over previous years, the NHS, if I just pick on the NHS, isn't a homogenous thing. It's built up of lots of different groups, and it's fair to say we've not acted coherently and strategically. But through Joined Up Care Derbyshire, our ambition is that's what we'll do. We'll act in unison in the health and social care space, so that we can be more influential and powerful, but also that through that relationship, so can the Health and Wellbeing Board and the socioeconomic groups. So that's our sort of ambition now, is to bring. So going forward, I was going to say a simple thing, but we've had several people from health come into the Health and Wellbeing Board today. Actually, our ambition is that in a few months' time, you'll have Joined Up Care Derbyshire representatives coming here, and we'll agree how to do that, and we'll be speaking with one voice, which I'm sure will be helpful. So I'll just that's the sort of intro and what's it all about, and I hope that's not news to anyone. But just to talk about integrated care systems, if I can. Don't worry, the slides are mainly for me as a prompt rather than for you. Otherwise, I've got that much going on at the moment. It'll keep me on track. But just to alert colleagues, at the end of November, and I think it was after when I came last, NHS England published a paper on saying, look, we want to go big on creating integrated care systems, and this is our view on them, and we're going to engage on that view, and we're going to put some views to government on what we think should happen. They were set out in this paper, but it built on views over the previous years from NHS England. So again, it wasn't news to us that this was coming, because it's been a building conversation, but also it builds on the conversations we were having locally anyway about the role of the NHS, the commissioner, the providers, and how we start to pull this together into Joined Up Care Derbyshire. So again, it was totally consistent, but it really did talk about health and social care systems. So again, that's a tick for Joined Up Care Derbyshire, because that's what we said we were. So that was, a big sign of, phew, we were in the right space. The engagement opportunity to early January, that's gone. So we're waiting to find out what's happened since. We are expecting still, although there's a lot of work going on around COVID, whether those timescales will change, we'll wait and see. But we are expecting change to still come. We haven't been told it's not. And if it does, legislation change from the 1st of April 2022. So, this the relatively short period of time, and we'll head into a transition period between now and then, of course. Big aims there around population health, tackling unequal outcomes and access. So absolutely in the gift on the health and care side around health and social care delivery, and, increasing productivity, no surprise to anybody here. But this is really, really important, and it's important to this conversation. It sets out the NHS's role in supporting broader social and economic development. So it takes us firmly as an NHS and social care system into saying we've got a role here in that 80%. Now, I think we knew that. We believed that before, but it's good to see. It's good to see in a national document. It's good to see in legislation, and it had a couple of big themes in this around about saying, look, We want to break down decisions to being closer to where it's important in communities, and I think we'd all agree with that. We've been wanting to do that through our version of Place for some time, and it sort of said, look, we need better collaboration between partners in a place, and clearly Derby City is a place that we all recognise, and then clearly there's a big drive that's going to probably influence the NHS side more, but there is a big drive around integrating care and collaboration between our providers of care. You know, we have hospitals and mental health trust, community trust, general practices. We've got to get better at collaborating between those groups, so that won't be a surprise to this board either. I'm not going to go through all of these, but just to say, you know, there's a lot going on around place, around collaboration between colleagues. Clearly, there's going to be a lot around the governance of this and the financial frameworks and the regulation, but there's a big thing around how commissioning will change in the NHS. And cutting a long story short for you, if NHS England's view on this becomes law, what will happen locally is that NHS Derby and Derbyshire CCG will move into a statutory NHS being called the Integrated Care System. You know, and the CCG will cease to exist from April 22, and its statutory functions will move into the ICS, and we'll need to work through how that will happen and how we do it in a transition way. But ultimately, that will happen, and we'll take that forward. So again, it's not news to us in terms of health and social care. It's not news to us in terms of sorting commissioning. We have a really important building conversation happening now between ourselves and the local authorities in Derby and Derbyshire about how do we bring commissioning together. We're linking that with NHS England to make it a really important conversation. It's not news to us about the importance of partnership, and it's not news to us about the wider terms of health. So hopefully you're assured on that. What was a bit news to us, if we're honest, is the rapidity, the speed of it. The CCG will cease to exist and formally morph. We did think we would still exist in some sort of statutory form, if not a functional sense. But it just means we've got to really think about the whole duties that the CCG side does. But that said, it's okay. We've got our heads around that and we'll make it work. What was interesting is it's very clear on the ICS boundary and the importance of upper tier local authority areas and the areas of the local resilience forum. Again, I don't see that as a major challenge for Derbyshire. We've got a couple of things around our borders just to consider there, but not from a Derby City perspective. And so what was really important is actually we took that through a load of governance, and Derby City colleagues were helping us with that. And actually we put a view into NHS England that says, yes, we're up for that. I've got a load of questions, but actually the direction of travel is what we've been wanting to do for a long time. So Joined Up Care Derbyshire has responded to the consultation engagement exercise saying, yes, this is the right thing to do. In parallel, we were on a track as Joined Up Care Derbyshire to apply for integrated care system status in parallel to what nationally was being engaged on. And I'm really pleased to say that we've been approved, and we are now officially, we've got the NHS badge that says tick, you're now an integrated care system. We didn't get that lightly. It wasn't an easy thing to do, and it's built on years of development. But there were a few things that we needed to pick out there that Regional Director of NHS England that sent through to us just saying, look, really good, but there's a few things that you need to develop, and it was really around homing in on our common objectives and shared outcomes, and I think we'd all agree with that, and that's why this conversation is important. It was also around, look, there's still some financial challenge going on, and you know that I've been to this board talking about finances, and so it's not a surprise that we still have a financial challenge in Derbyshire, particularly on the NHS side, but I know local authorities is equally challenged. We need to continue thinking about the work on strategic commissioning between the NHS, local authorities. Now, again, we're on with it. And we need to really think through our footprints on place. And I know that's been a live conversation. for us. My instinct is that we've got a really good view of that from a city perspective. So we're clearly working through it. I'm going to skip through this slide because I really want to come back to this anchor if I can, because it feels really important. But I'm not going to bore you to tears with this diagram, except that I'll have to bore you to tears to get to the next couple of slides. So I'm afraid there's no way but to take you through it. But essentially, you've seen this slide before. We're building Joined Up Care Derbyshire to really think about the strategic outcomes we want to do. We're really building around strategic partnerships. We're really building around strategic use of assets, you know, really our people, our money, our places. And we're really thinking about how do we use intelligence, innovation and transformation to pull this off and to really make a difference on those overall outcomes. And clearly we're thinking about the leadership and governance that's required. The advanced health warning, the next slide will blow your mind a bit, but I'll just take you to one corner, so bear with. I don't have a slide that just has the corner in it. I need to create one, but time hasn't allowed. But it's a beautiful colour, mine, and so hopefully you won't mind. Ignore all this stuff if you can. It's this bit I need to just focus this board's attention on here. And what we're saying and what we're trying to create some structure around is, look, Joined Up Care Derbyshire wants to work in partnership with the Health and Wellbeing Board in a coherent and cohesive way. It wants to work in partnership on socioeconomic issues. It wants to do that. And we're starting that conversation with the board. That's the point of bringing it here, with local authority leaders, about how we do that in a useful and meaningful way. And just I talked about it before, but it just feels really important to bring back, is we think as Joined Up Care Derbyshire, through the scale of employment that we do, through the thousands and thousands of people that we employ, we've got a lot to offer in the wider determinant space, in the 80%. And we're terming that the anchor approach. I've mentioned it before. And we think if we work together, and we work in partnership with Health and Wellbeing Boards, we work in partnership with socioeconomic groups, we think we've got a lot to offer around the areas of employment opportunity, staff well-being. So if we improve the well-being of those thousands of staff and their connections and their networks, that we can do something really great. We think we can do something if we take a social value of procurement approach. So so my organisation spends £1.6 billion in Derby and Derbyshire and there or thereabouts. 75% of that will eventually go on wages, but a lot of it will also go on buying things, buying equipment, all those things. Is there a way we can think about social value in procurement? What can we do there? If we shifted just 2 to 5% of that spend to procuring in a different way, what could we do? Clearly, we think through the organisations we've got, the staff base, clearly we've got a role to play around sustainability in the environment. And I'm sure we've got a lot to offer around supporting community resilience. So we're setting it up. Ifty's on this call. Ifty's going to lead from an executive perspective the work around anchor and really start to build those conversations. But it just feels really important. And so I'll stop there. Thank you. It's just been really helpful for me just to lift my head up and just think to the future. But I'll take obviously any questions. Thank you, colleagues.
Thank you. I think we've got Alison and then Hardiel after that, if you want to ask your questions.
Thank you, Meryl. It's not really a question, just a comment or suggestion, really. And just to note that as a Health and Wellbeing Board, we're required to have a health and wellbeing strategy, and ours is currently out of date. So we do need to start work on that. And I do wonder if that's perhaps an opportunity to bring together and perhaps articulate some of those joint ambitions and perhaps also the approaches that we were just talking about in kind of the items before that kind of Rachel, Kim and Carl were bringing in. And perhaps is that almost the articulation of that space in the corner that you were just describing, Chris? It probably just needs a little bit of thinking about, but I think is perhaps a way and means of pulling some of that thinking and ambitions together.
Yeah, I couldn't agree more. I'm going to need your help with it, Alison, and everybody else on this call. It's a massive thing, isn't it? Let's be honest, it's huge, this. But, you know, yeah, please.
Thank you. Hardy, do you want to ask your question?
Thank you. Chris, I feel for you. This is a massive undertaking and shift and transition. But the question that comes to my mind, and it was a question I raised in the previous initiative, all well and good in terms of words and strategies and policies, but without your demands for whatever structure you have in the future will not change. And to get the 80% input that you desire, the government desires, everybody desires, and which is something that was where, going back a few more years, that's where we were in a shape, and we had to pull back from all that because of the demands on health. And I do get the integrated care system, and that's totally right, 100% supportive. But we can have lots of plans and discussions, whereas the bottom line budgets, how do you square the demands, which the demands are not going to disappear, and then you've got to create the space, which has been lost over the last, 10 years, 8 to 10 years. And that's the challenge for all of us, not just for you, but I think that's the question about how do we, changing is okay, but it takes a few years before you understand what the changes are, and then you understand what the impact is. And by that time, a lot of water's gone under the bridge. So, have you given any thoughts about what this will mean in terms of that releasing funds to put where we all agree it will make a difference in terms of the partnership working?
Yeah, I mean it's the universal question, that one, isn't it? And I've given shed loads of thought to it, not just in the last few weeks, but in the last few years and years and years and years, and no doubt it's taken its toll. But I think there's a version of that question for every single organisation on this call. So if I'm sat where Rachel is sat in the City Council, there is a version of that says demand is getting out of control. We haven't got the resources to match that demand. How do we stop reacting to it and get ahead of it? You know, and that there'll be. I know there's a version of that in social care. I bet you there's a version of that in I know there's a version of that in policing. You know, it's the same question. I know you're as keen as mustard to get into prevention space. I know you are. And I suppose what we're getting to now is, right, if we don't, this situation we're dealing with now is getting worse. So we now have to act in unison. I think the important thing here is in what I'm driving is, right, okay, what is the health and social care's offer now into the wider determinants? So let's stop just talking about it. What is the offer? I think we're setting out, we think this is where we can make a difference now, and we now have to demarcate that out and follow that up with action. I think before I think it's been easy to be disparate. I think because we've not had a cohesive view, we've been able to look in individual organisational lines, and I think that makes it far easier to not do that. But I think we're getting to the point now of saying no, this is our collective approach, and we're now going to commit. Not that we haven't committed before, and not that we haven't done things in these arenas before, but I think it's now about power. I think it's about scale, and I think it is about saying what is the commitment. You know me, I've been trying to influence this space for a while, and I think we're on the brink of it. So I think Joined Up Care Board, I mean, IFTI's on the call, I'm not going to put too much on his shoulders, but I could see a situation in the future where Joined Up Care Board is saying to IFTI, right, IFTI, what is our programme in the anchor space? What is our programme of work now in the, with the health and wellbeing boards? What is the reciprocal ask of Joined Up Care for that, and what's the reciprocal ask of other partners? And having clarity around that, which I think would be universally different to where we've been. But as Alison said, I'm not going to be able to do it alone. There's a bigger partnership there to influence, but I think that coherence is just crucial. Anyway, IFTI wants to come in, so I'll hand over to IFTI, who's helping me with it.
Okay, Chris, thanks. I was just going to say that for me, actually, one of the keys is thinking wider than just Joined Up Care, thinking wider than just the health and social care partnership into that outer circle that you put on about the bigger socioeconomic. And actually, I think, I had a great conversation with Andy Smith when we were starting to think about what's our next step. And actually, our next step is to agree who the anchors are. Because the anchors aren't just the health organisations. They're not just the social care. Actually, there are anchors out there in the community, in the business sector as well. Some of the biggest employers sit there as well as these other sectors. And I think that starts to be a very different proposition then, doesn't it? As opposed to the historical way of working, which is that, let's be honest about it, we in health believe that we're the centre of the universe and everybody should come to us. And it's a little bit like Rachel was saying with her playing field diagram. Actually, I think that's what Anchor is all about. So, and just to Hardill's point, that there are some cracking examples already in the, just in the last year of how we've started to think about pathways rather than being clinical pathways, rather than being care, support and intervention pathways that go right down to relative supporting an individual in somebody's local community up to admission into a specialist forensic high secure unit. That's a pathway, and actually we need to be able to flow funding and money all the way down that pathway. And we have done, Chris, haven't we? I mean, certainly if I'm being parochial about it, we have moved money from within the mental health sector. We've moved investment into into local communities to deliver services. So actually, I think we are starting to do that, and I think some of the infrastructure that Chris described really gives us that impetus and that permission going forward. I'll stop because I'm going to cough.
Roy wanted to come in with a comment.
Thank you. IFTI, you're not at the centre of the universe. If you look at my background, I am. But to be serious, I think that, what you're asking for, Chris, is cooperation, collaboration. And I think as a health and wellbeing board, we've done this before. And the solution I would suggest would be to set up a task and finish group. So selected individuals that can help make the input into this and that would report back to the Health and Wellbeing Board on progress, on where we're going, what we're doing and what value we're adding to our community in taking away health inequalities. And one of the important partners that should be on that task and finish group is our Community Action Derby, to make sure that the voice of communities that has come out very strong in the COVID-19 situation is there at the start, influencing rather than picking up the pieces after the work's been done.
Thank you for that. I think Hardiel wanted to come back with just a supplemental question to shoot, did you? And then I think we'll need to move on after that.
Thank you, Meryl. I just want to say, Chris, totally with everything about wanting to make it work, and I'll do my bit to do that. That corner in that big slide you had with the lots of boxes, I would say, and you would expect me to say that there needs to be a partnership and dialogue between criminal justice and health. So just to sort of say, when you're looking at expanding that little corner, have a think about how we have that. We've had a conversation like that. Mental health is a big issue in terms of where in terms of mental health, and lots of good ideas and models we've got. Funding in the past has slowed down happening, but that might be changing on mental health, hopefully. And there's conversation we've had about lots of areas where the help that can make a difference for, in addition to the socio-economic, for that subset.
Thank you for that. We'll move on now, if that's okay, and go over to Kirsten Mcmillan.
I think if he's desperate to come in, Meryl.
Oh, and sorry.
Sorry, it's okay, Meryl. I just wanted to, it is fantastic to hear the enthusiasm from everybody, because I think what Chris has been trying to describe and what I was trying to describe is exactly what people, colleagues in the room are saying around, everybody wanting to get involved and be part of developing this co-creation, but more than that, this joint leadership. And harder, the police, I suppose not just the police, but other public sector organisations have to be part of this. And it's got to be a broad conversation. Roy's point about we need a group to coordinate it. Well, that's exactly the box that Chris was talking about. And actually, I see my role as the exec lead being accountable jointly, yes, to Joined Up Care Derbyshire, but to the Health and Wellbeing Board, because it's got to be across the board. So I think it's there. That's what we're talking about.
Thank you for that. We'll move on to Kirsten Mcmillan now with the Better Care Fund, and I'm really sorry we're running so late. I'll do better next time.
That's okay. Hi, everybody. I'm well aware that you're running over, and I feel that after the big discussion we've just had, these reports just seem slightly less interesting. Do you want me just to take any questions? This one is really on the Better Care Fund, is getting the board really just to support the current year's expenditure. And if I'm honest, there's not much more I could add to that, because we're in January. Unlike local government, I have to say the NHS are much more comfortable kind of working backwards in terms of funding allocations. So the report is what it is. I don't know whether anyone just wants to ask any questions to try and save time.
Yeah, has anybody got any questions? Certainly seems to be, a very well written report, and I certainly support everything that's in it. Has anybody got any other comments or questions?
Has Councillor Hussain got his hand up for this item?
Yes, I'm sure he has. I'm just not very good at looking at it. Did you want to come in, Councillor Hussain? You're on mute.
Sorry, I raised my hand for the previous item, but
I'm sorry.
So I'll go without my contribution. It's not
sorry.
I can't take questions for the last item.
Anybody else got any other questions? And you've got the Winter Fund update as well, but that's for information. Is that, or the Winter Plan? Have you got anybody got any questions for that? Anything you want to fill us in, Kirsty, or?
We aren't required to publish this, but we decided that we would do. Although again, it feels a little bit, mind you, we're still in winter, looking out the window. This is just really setting out how adult social care is responding to the winter pressures. Obviously, the COVID pressures are on top of that, but I think it's just useful for the board to see, and I can take any questions, or people can just read it at their leisure.
It's certainly useful to know what's happening with the plan, and encouraging to see all that's in the document. Has anybody got any questions? Councillor Sen, you still got your hand up. Was that from the previous? previous comments. Has anybody else got any other questions?
The only thing I wanted to point out, it's not in the report, but I suppose it's reasonably hot off the press. It'd be useful to know, because I know there was some chat about care homes in the meeting earlier, that hopefully by the middle of next week, all the older adults care homes in Derby will have had their COVID vaccinations, or the residents. There's a huge logistical effort going on, and a large number of homes have been vaccinated over the next 4 or 5 days. I thought that was a good news story just to end on.
Yeah, there's certainly a priority. It's just the Oxford vaccine and getting out to them. But yeah, all the systems are in place, so hopefully that will be completed soon. And Gumel, did you have anything to say about your report at all? Is there anything you want to update us on the SEND report for the children and young people?
Yeah, thank you, Chair. I'll be very brief. Just main points really around the SEND Joint Commissioning Strategy has been agreed and co-produced with parents. There are 4 priorities that are outlined within the report. We are now working closely with parents, health colleagues, other local area colleagues as well, in taking forward the SEND Commissioning Strategy. Chair, nothing to add. I think it's fairly self-explanatory. Happy to take any questions.
Okay. Oh, just bear with me. Just trying to see who's got a question. Oh, it's Danielle. Do you want to ask your question, Danielle?
Yeah, thank you. First of all, I'd like to commend the commitment to co-production and working towards the changing culture needed to embed the Children and Families Act 2014. Secondly, I have a query regarding page 4 of the statistics, and I wanted to know if we could have clarification around why is speech, language and communication needs listed as a primary need separate from autism spectrum disorder, when speech, language and communication needs encompass a wide range of difficulties such as autism, as autism is characterised, ASD is characterised by speech, language and communication needs. My second question, if you want to give me both, my second question would be regarding the bullet points at the top of that page. It states moderate learning difficulties, and then in brackets it says in England this is speech, language and communication needs. So could we have some clarification over that, please? Thank you.
Thank you, Danielle. Can I just ask, are you talking about the SEND commissioning report that's there, or are you referring to another item?
Which item am I on? Am I on the wrong one?
Possibly, because my report doesn't
SEND
cover
commissioning
that.
strategy. Yeah, the SEND commissioning strategy.
Oh, okay, I'm with you.
Yeah, SEND commissioning strategy, page
I've got
4.
you. Yeah. I think it would be easier, Danielle, to come back to you separately on that, because some of those stats, as you know, are quite complicated behind MLD. So if you're comfortable, can I come back to you? Some of that data will have come from other data sets as well.
Yes, yeah, I'm just concerned. There seems to be some overlap there and confusion regarding speech, language and communication needs. As I say, speech, language and communication needs actually encompasses autism spectrum disorder in any case. So I'm just surprised that they've been separated from the point of the statistics. And at the top of the page, moderate learning difficulties. We're saying moderate learning difficulties has increased significantly and is overrepresentative as the most common type of primary need in Derby. But then in brackets, we've put in England, this is speech, language and communication needs. I'm just really confused. So yes, I'd appreciate some feedback on that, please, Camille.
Yeah, I will do. I'll pick it up for you separately. Just very briefly, some of these are DFE categorised and some of these tie back to the joint strategic needs assessment, but I'll come back to you separately if that's okay. Thank you, Chair.
Thank you.
Are there any other questions from anybody? Councillor Hussain, you've got your hand up. Is that from a previous question? So you're on mute. You're on mute, Councillor Hussain.
Merrill, I think the hand's down. It might be stuck up on your.
Oh, is it stuck up on mine? Oh, sorry. Okay, sorry.
Yeah, sorry, I don't know how to take it off, so it stayed up from the last time round.
Okay, sorry. Any other questions from anybody else? Well, thank you all for coming. I'm sorry it's overrun. And has anybody got anything else they want to bring before we finish the meeting? No? Okay. Well, I wish you all well and keep safe, and we'll meet at the next board meeting. Thank you.